Mark. Thank you very much. We are your vaccine authority, and each day we are getting answers to the questions you have been asking. And this afternoon, we're looking deeper into vaccine side effects and the possibility for people to confuse them with actual medical conditions. Joining us live to sort this all out is Dr. Anuj Vohra, who is the Medical Director of Emergency Services at Hartford HealthCare. Doctor, thank you so much for being with us.
Oh, it's my pleasure. Thanks for having me today.
So we've been talking a lot about side effects, especially after that second shot. Are any of your hospitals or doctors noticing this happening, where people are maybe delaying coming in for treatment or for appointments because they are experiencing these side effects from a vaccine and maybe think it's something else?
We are seeing some people coming in with various symptoms where we're unsure if it's certainly a vaccination side effect or something indifferent. What I would always recommend to patients that don't feel well, even after the vaccine, is to come in to get evaluated so we can differentiate the two. Certainly, you may have flu-like symptoms after the vaccine. That's to be expected. But there are many other illnesses that can be commingled at the same time as getting a vaccination, so it's always better to come in and get checked out.
There are a variety of side effects that people can get from the vaccine, and every person's different. For folks at home, how can they distinguish between side effects from the vaccine and potentially a serious medical event?
Great question. I would say a serious medical event would be considered symptoms of shortness of breath or difficulty breathing, severe chest pain or severe abdominal pain. Those would be symptoms that I'd want to see a patient in our emergency department for. If you had more minor symptoms like some body aches or myalgias, a low-grade temperature, generalized weakness, that's more of the typical commonplace side effects that we see post-second dose, and they tend to only last 24 hours. Most patients have reported that their post-dose side effects have been pretty short-lived, and they go away spontaneously.
We've heard a lot about the flu-like side effects. They tend to be more common. What are some side effects that would be less common or potentially more concerning?
So it's difficult to ascertain whether these are true side effects or not, because we are seeing patients coming in post-vaccine with shortness of breath or stroke-like symptoms or heart attacks. While there's no association proven to be related to the COVID vaccine post-dose, it could just be a coincidence, and likely that's what it is. So we haven't had the time to really differentiate those two in the emergency department. But I would say if you're having any concerning side effects and you're unsure of what it is, seek professional help where we can help figure it out. Typically, the side effects, like we talked about, being flu-like symptoms, are pretty mild, and they tend to pass pretty quickly. But when in doubt, come on in and we're here for you.
I was just going to say, too, if people are waiting for that second dose and they're a little bit nervous about these side effects, it's not something that should dissuade them from getting that second dose of either Moderna or Pfizer.
Absolutely, I agree. If you think about the worst case scenario of COVID illness, it's death. If we look about the spectrum of 1 to 10, 10 being the worst, we're trying to prevent the 10, the 9, the 8. So 10 being death, 9 being put on a ventilator, 8 being on life support for breathing, things of that nature. What the vaccine does is it reduces all of those high risk and high mortality issues and puts us more into the flu-like illness of feeling category, where it's safe, it doesn't feel good, but they're temporary side effects. And the benefit is it's here to save our lives, and it's here to help prevent the spread to others that we care about and love. So it's very important to get the vaccine, and I strongly recommend getting the second dose.
Well, thank you so much for your expertise. We certainly appreciate it. Dr. Anuj Vohra with Hartford HealthCare. Thank you.
My pleasure. Take care.
You too.